Welcome to San Diego, California, home of Maverick Physical Therapy. I'm Mark Frenz, the owner of Maverick Physical Therapy. We're going to title this little video footage and shoot with election season upon us as "Let's Make Healthcare Great Again." Let's make differential diagnosis for clinicians great again. Let's make clinicians great again. Let's make clinicians more creatively industrious and integrated again. Let's make hypothesizing from a clinician's perspective great again. So today we're going to be talking about where we've been historically with healthcare, where we are today, and where we're going and where we should go. And we're going to tie in and talk about the Patient Protection and Affordable Care Act, also known as Obamacare. One of the worst things that could have ever taken place and happened with regards to healthcare in our country is Obamacare, the Patient Protection and Affordable Care Act. And there's several reasons for that. So as clinicians, very unfortunately today there's not a lot of clinicians that are well educated with regards to Obamacare and how that hurts them in many ways. And patient-wise, the consumer not educated very well at all with regards to the proceedings of the Patient Protection and Affordable Care Act, again, Obamacare. So 2009 progressing and picking up some serious steam. In 2010 we have the infiltration of Obamacare, in which the federal government, Barack Obama, realized and knew that, hey, healthcare is the 6th largest revenue building system in the United States of America. Let's take it over. Let's intervene and implement regulations, laws, and rules that are given judgment by people that aren't even in the healthcare field to clinicians and down to clinicians, so that we can bring in a massive amount of revenue. Let me state that free does not mean good at all. Free does not mean good. Ultimately, there's a lot of people, a vast majority of United States citizens have been affected by this act in several different ways. The general civilian, premiums and copays have shot through the roof. Premiums, if you're a healthy individual, sorry, you're paying for unhealthy individuals. And that's continued to skyrocket 40, 50, 60, 70% over the course of the last 5 or 6 weeks, making making health insurance almost basically unaffordable. You can't. It was told that you could keep your clinician. A lot of people couldn't keep their clinicians, their primary care doctors, etc., that they'd had for and had their story known by them for quite some time. You've had the onset of clinicians then that are forced to see several patients monthly and weekly to meet specific requirements that have been set forth by Obamacare to be compliant, and which ensuing have slashed reimbursement rates drastically, meaning clinicians have to see a higher volume of patients in less time. Makes sense? Don't get reimbursed as well. You still need to be compensated the same, generally speaking, for your practice or you as the individual. So numbers wise, you need to as a clinic and as an individual reach a certain amount of visits and patients seen throughout a day and a week to meet ends meet. And so you as the individual, as the patient, as the consumer, you go to see your clinician, you spend 5 or 10 minutes perhaps somewhat in conversation with them as their head is stuck in an iPad or in a computer typing away, not hypothesizing and not facilitating the right questions that need to be asked with regards to what you potentially have going on. And that unfortunately has led to clinicians missing significantly big things with very poor differential diagnosis, first means a lot of times is the pharmacological route. Here's a prescription. Maybe second, okay, it's been going on for a while. Let's do some imaging. Let's do an X-ray, an MRI, or CT scan. I'll write you a script for that and get out of here. We're not asking individuals the right questions and facilitating the right questions that are enabling us to make sense of things. Hey, was there a mechanism of injury? What are the exacerbating and alleviating factors? When are they better? When are they worse? Putting things together. And as a physical therapist, we need to be able to reproduce those symptoms with movement and take them away three-dimensionally, and it needs to be able to make sense from a pathological state, from a musculoskeletal kind of based stance as the primary care physician of the musculoskeletal system. You, the consumer, the patient, then are given a medical diagnosis that's actually a billing code that says, hey, generalized weakness or gait abnormality or right hip pain or left knee pain or right foot pain or right shoulder pain or rotator cuff syndrome or adhesive capsulitis, frozen shoulder, hip bursitis. We have clinicians that are looking at anatomical locations and spots and not giving the appropriate amount of time and facilitating with good differential diagnosis to accumulate good best exam findings that then enable you to back up a hypothesis or cluster a group of best exam findings and say, hey, this is what you have going on. And really importantly, hey, why do you have that going on? Getting to the root of the problem. So today we're really missing out on, as a clinician, giving the patient the best care. When multiple disciplines are involved, we have clinicians that are fearful, not courageous enough, and not industrious enough to perform the most appropriate and best exam findings via their differential diagnosis to go against other clinicians' judgment. That shouldn't be the case. If you're hypothesizing correctly and bringing up in conversation the right things that you need to, you should be able to cluster and clump together the right best exam findings to give you the opportunity to make a good educational and systematic, based on the customization of that individual and pathology, what they have going on, a decision with regards to what that rehab diagnosis is. So, Patient Protection and Affordable Care Act, in terms of premiums and copays, has skyrocketed and will continue to do so, but